1. Furosemide can cause hypokalemia as a side effect? Answer: true. Rationale: furosemide is a loop diuretic that increases the excretion of sodium, chloride, and water, which can also lead to potassium loss and result in hypokalemia. Monitoring electrolytes is essential during therapy. 2. Aspirin should be taken with food to prevent gastrointestinal irritation? Answer: true. Rationale: aspirin is a nonsteroidal anti-inflammatory drug, NSAID, that can cause GI upset and bleeding. Taking it with food helps minimize these effects. 3. Beta blockers are contraindicated in patients with asthma due to the risk of bronchoconstriction? Answer: true. Rationale: non-selective beta blockers block both beta-1 and beta-2 receptors, and beta-2 blockade in the lungs can cause bronchoconstriction, worsening asthma symptoms. 4. Nifedipine may cause reflex tachycardia as a side effect? Answer: true. Rationale: nifedipine, a calcium channel blocker, can cause vasodilation and a drop in blood pressure, which triggers a compensatory increase in heart rate. 5. Morphine sulfate commonly causes diarrhea as a side effect? Answer: false. Rationale: morphine typically causes constipation by slowing gastrointestinal motility, which is one of its most common side effects. 6. Metformin can cause lactic acidosis in rare cases? Answer: true. Rationale: metformin may accumulate and increase the risk of lactic acidosis, especially in patients with renal impairment. Monitoring renal function is important. 7. Phenytoin toxicity can cause nystagmus and ataxia? Answer: true. Rationale: high levels of phenytoin, an antiepileptic drug, can cause central nervous system side effects such as nystagmus, ataxia, and confusion. 8. Warfarin's therapeutic effect can be reversed by administering vitamin K? Answer: true. Rationale: warfarin is a vitamin K antagonist, and its anticoagulant effect can be reversed with vitamin K in cases of overdose or excessive bleeding. 9. ACE inhibitors are associated with a risk of dry cough due to bradykinin accumulation? Answer: true. Rationale: ACE inhibitors prevent bradykinin breakdown, which can lead to persistent dry cough in some patients. 10. Digoxin toxicity is less likely in patients with hypokalemia? Answer: false. Rationale: hypokalemia increases the risk of digoxin toxicity because low potassium levels enhance digoxin's effects on cardiac muscle. 11. Naloxone is an opioid antagonist used to reverse opioid overdose? Answer: true. Rationale: naloxone binds to opioid receptors and displaces opioid molecules, reversing respiratory depression and sedation. 12. Tetracycline should be taken with milk to improve absorption? Answer: false. Rationale: calcium in milk binds with tetracycline and reduces its absorption. It should be taken on an empty stomach with water. 13. Atorvastatin is best taken in the morning to match the body's cholesterol production? Answer: false. Rationale: statins like atorvastatin are usually more effective when taken in the evening because the liver produces more cholesterol at night. 14. Anticholinergic drugs can cause dry mouth, blurred vision, and urinary retention? Answer: true. Rationale: these drugs block parasympathetic activity, leading to common anticholinergic effects such as dry mouth, blurred vision, and urinary retention. 15. Lithium toxicity can occur with dehydration or sodium depletion. Answer: true. Rationale: lithium is excreted by the kidneys and competes with sodium. Dehydration or low sodium can increase lithium levels, leading to toxicity. 16. Insulin glargine has a peak effect 2 hours after administration? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak. It provides a steady level over 24 hours. 17. Gentamicin can cause ototoxicity and nephrotoxicity. Answer: true. Rationale: gentamicin, an aminoglycoside, is associated with toxicity to the kidneys and the ears, requiring close monitoring of drug levels. 18. Ranitidine is a proton pump inhibitor that decreases stomach acid? Answer: false. Rationale: ranitidine is an H2 receptor antagonist, not a PPI. It reduces acid production, but through a different mechanism than PPIs. 19. Albuterol is a beta-2 agonist that causes bronchodilation? Answer: true. Rationale: albuterol stimulates beta-2 receptors in the lungs, relaxing bronchial muscles and improving airflow in conditions like asthma. 20. Heparin is monitored using the International Normalized Ratio, INR? Answer: false. Rationale: heparin's effect is monitored using APTT, activated partial thromboplastin time, whereas INR is used for monitoring warfarin. 21. Ondansetron is used to prevent nausea and vomiting? Answer: true. Rationale: ondansetron is a serotonin receptor antagonist used commonly in chemotherapy, postoperative, and other nausea-inducing conditions. 22. Prednisone may cause hyperglycemia as a side effect? Answer: true. Rationale: corticosteroids like prednisone increase blood glucose by promoting gluconeogenesis and reducing insulin sensitivity. 23. Nitroglycerin can cause headaches due to vasodilation? Answer: true. Rationale: nitroglycerin relaxes blood vessels, which can lead to increased blood flow to the brain and result in headaches. 24. Clopidogrel is used to treat hypertension? Answer: false. Rationale: clopidogrel is an antiplatelet agent used to reduce the risk of stroke or heart attack, not to lower blood pressure. 25. Fluoxetine can increase the risk of serotonin syndrome if combined with MAO inhibitors? Answer: true. Rationale: SSRIs like fluoxetine, when combined with MAOIs, can dangerously elevate serotonin levels, leading to serotonin syndrome. 26. Acetaminophen overdose can cause liver damage? Answer: true. Rationale: high doses of acetaminophen can overwhelm liver metabolism, producing toxic metabolites that cause hepatotoxicity. 27. Epinephrine can cause increased heart rate and blood pressure? Answer: true. Rationale: epinephrine stimulates alpha and beta receptors, resulting in vasoconstriction and increased cardiac output. 28. Diazepam is contraindicated in patients with respiratory depression? Answer: true. Rationale: benzodiazepines depress the central nervous system and can worsen respiratory depression, especially in compromised patients. 29. Lisinopril is a calcium channel blocker? Answer: false. Rationale: lisinopril is an ACE inhibitor that lowers blood pressure by inhibiting the renin-angiotensin system, not by blocking calcium channels. 30. Methotrexate is safe for use during pregnancy? Answer: false. Rationale: methotrexate is a folate antagonist and is contraindicated during pregnancy due to its teratogenic effects. 31. Spironolactone can cause hyperkalemia? Answer: true. Rationale: spironolactone is a potassium-sparing diuretic and can lead to elevated potassium levels, especially in patients with renal impairment. 32. Metoprolol selectively blocks beta-1 receptors in the heart? Answer: true. Rationale: metoprolol is a cardioselective beta blocker that reduces heart rate and contractility by blocking beta-1 receptors. 33. Iron supplements should be taken with calcium for better absorption? Answer: false. Rationale: calcium interferes with iron absorption. Iron is better absorbed on an empty stomach or with vitamin C. 34. Lorazepam can cause sedation and should be used cautiously in the elderly? Answer: true. Rationale: benzodiazepines can cause sedation and increase fall risk, particularly in older adults, due to altered drug metabolism. 35. Isotretinoin requires strict pregnancy prevention due to teratogenicity. Answer: true. Rationale: isotretinoin is highly teratogenic and requires participation in a risk management program for pregnancy prevention. 36. Levothyroxine should be taken at bedtime for best absorption? Answer: false. Rationale: levothyroxine is best absorbed when taken on an empty stomach, typically in the morning before breakfast. 37. Carbamazepine can decrease the effectiveness of oral contraceptives? Answer: true. Rationale: carbamazepine induces liver enzymes, which can increase metabolism of contraceptives and reduce their efficacy. 38. Rivaroxaban requires routine blood test monitoring? Answer: false. Rationale: Unlike warfarin, rivaroxaban does not require routine INR monitoring due to its predictable pharmacokinetics. 39. Amiodarone can cause pulmonary toxicity with long-term use? Answer: true. Rationale: amiodarone has several serious side effects, including pulmonary fibrosis, requiring regular monitoring. 40. Ciprofloxacin should not be taken with antacids? Answer: true. Rationale: antacids can bind to ciprofloxacin and reduce its absorption, leading to subtherapeutic levels. 41. Nalbuphine is a full opioid agonist used for severe pain? Answer: false. Rationale: nalbuphine is a mixed agonist-antagonist opioid and may not be effective for patients with high opioid tolerance. 42. Clonidine is primarily used to treat insomnia? Answer: false. Rationale: clonidine is an alpha-2 agonist used to treat hypertension and occasionally ADHD, not insomnia. 43. Docusate sodium is a stimulant laxative? Answer: false. Rationale: docusate is a stool softener, not a stimulant. It works by increasing water in the stool. 44. Vancomycin should be infused slowly to prevent red man syndrome? Answer: true. Rationale: rapid infusion of vancomycin can cause flushing and hypotension, known as red man syndrome. 45. Glipizide stimulates insulin release from the pancreas? Answer: true. Rationale: glipizide is a sulfonylurea that promotes insulin secretion from functioning pancreatic beta cells. 46. Buspirone has immediate anti-anxiety effects? Answer: false. Rationale: buspirone requires 2 to 4 weeks for full effect and is not useful for acute anxiety attacks. 47. Haloperidol can cause extrapyramidal symptoms? Answer: true. Rationale: haloperidol, a typical antipsychotic, blocks dopamine receptors and is associated with movement-related side effects. 48. Acetazolamide is used to treat glaucoma and altitude sickness? Answer: true. Rationale: acetazolamide reduces aqueous humor production and helps correct metabolic alkalosis at high altitudes. 49. Methadone has a short half-life, requiring frequent dosing? Answer: false. Rationale: methadone has a long half-life, which allows for once or twice daily dosing in most cases. 50. Linezolid should be avoided with foods high in tyramine? Answer: true. Rationale: linezolid is a MAOI-like antibiotic and can cause hypertensive crisis when combined with tyramine-rich foods.